there are obviously many causes of urinary incontinence, but 85% are either due to a weakness of the urethral muscle, which will lead to leakage when somebody coughs, strains. And the main cause of this is vaginal delivery. We know that the sphincter becomes damaged at any time after 5 centimeters of the cervix dilating. And this is why even women who've had an emergency cesarean section could suffer from stress incontinence. The other main cause of urinary incontinence is where the bladder contracts in inappropriate times. And this leads to an overactive bladder. And the key symptoms are passing urine frequently, which is really defined not by the number of times the person passes urine, but that they are having to pass urine at times which are actually bothersome to them. So in the middle of a meeting, as they're trying to go somewhere, such that the patient has to almost decide, where the toilets are. It's called toilet mapping. That the patient also is not able to delay passing urine. And we generally would say, if you can hold on or delay passing urine by 12 minutes, then you wouldn't have urgency. And then the last part of this overactive bladder is urgency urinary incontinence. And this is the sudden, compelling feeling of needing to pass urine and then needing to rush to find a toilet. Otherwise, the person may have leakage. And this is most commonly noticed by patients when they are coming home. They put a key in the door, then suddenly find that they have to go and pass urine. So this is, latchkey incontinence. The sort of lifestyle changes that can help manage urinary incontinence are obviously looking at the amount of fluid being drunk. One of the things which is misunderstood about drinking fluid is that it is based on weight. So the standard 2 liters of water a day is based on a 70-kilogram person. But importantly, out of those 2 liters, over 500 milliliters will come from food. So this means that on average, people should only drink 1.5 liters a day. If a person drinks more than 3 liters of water a day, they are actually more likely to have urinary incontinence. And also they are more likely to also have urinary tract infections. And we think that that's mainly due to the excessive drinking during the day means that the kidneys try to get rid of the water during the day and the night. And when a person wakes up in the morning, they are actually severely dehydrated because the bodies try to get rid of all that water. So fluid intake, very important. It's based on weight, and also you must remember that over 500 milliliters will come from food. Other lifestyle changes which can help if a patient is having urinary tract infections after sex, it's really important not to pass urine before having sex, but to pass urine afterwards. And other things can help, like D-mannose, 1 gram of D-mannose twice a day. This has been shown in placebo-controlled studies to reduce the risk of urinary tract infection. Also, if a woman is postmenopausal, using vaginal estrogens reduces the risk of urinary tract infection by 50%. So There are all sorts of changes and approaches which can actually manage and help urinary incontinence or urinary tract symptoms. Now, in terms of what treatment options are open for women with urinary incontinence, there's a wide range. On one hand, we have the simple things such as training the bladder, passing urine by the clock, or having pelvic floor exercises with a physiotherapist, because we know that over half of women who try to do pelvic floor exercises on their own, instead of contracting their pelvic floor, they're often relaxing their pelvic floor. So having somebody to examine and make sure that the right exercise is being done is really important. Other treatments there are tablet treatments for the overactive bladder, and these are 3 to 6 months. And we find that over 50% of people at the end of that time do not need the tablets, and their bladder will go back to being normal. Other treatments for the overactive bladder can be, we stimulate the nerve in the ankle with an acupuncture needle, and that's called posterior tibial nerve stimulation. And we also do things like Botox in the bladder, stimulate the nerves in the back for very severe cases, and that's a permanent implant called SNS. And from the point of view of stress incontinence, there are injections which can be put around the bladder neck, which are done as a day case or can even be done under local anesthetic. And on the other side, we have operations where we will either put a sling or stitches, such as a Colpo suspension, to support the bladder and produce a hammock around the urethra to stop urinary incontinence. And the operations, such as Colpo suspension or slings, patients have been followed up for 20, 25 years, and the success rates are around 80%. Now, urinary incontinence occurs in men and women. It increases with age, and of men and women over the age of 70, 70% will have incontinence and bladder problems. And this is the reason why so many people think it's normal, because everyone around them has this problem. But that doesn't mean that a patient has to suffer this problem. And it's really important that if the bladder is affecting you, that a patient does get treatment, because it can transform someone's life. I think it's really important people shouldn't suffer. I think this is, in a way, bladder problems, when looking at diseases and trying to see how patients feel about different illnesses and diseases, it is one of the most shameful problems, and it really inhibits people in coming forward. I think what's important is when you come forward with a problem like incontinence or prolapse, I will certainly take it seriously, and I will do my very best to actually not just improve your quality of life, but to make sure that it no longer causes you problems.